The rehab industry is broken. And I don't mean a chip here or a little dent there. I mean broken. Like when your car is totaled, but it still kind of drives a little bit. And you got to turn up the radio really loud to not hear all the rattling and the parts falling off. And any minute, the whole thing could break down, leaving you stranded on the 405. So how did this happen? Well, we've all seen recent articles about corruption and bad billing practices and unqualified shady people popping out rehabs like organic vegan food stores in Santa Monica. And this has led to families being totally confused as to how to get help for their loved ones. I mean, I get asked all the time by families and even patients themselves, what's happened to the treatment industry? How do we get real help? Real help from qualified people. You see, asking for help is being in an incredibly vulnerable state. You're trusting these people at the center with your health, your emotional, mental state, your family, your finances, everything. And the last thing you want is to be taken advantage of or manipulated or not respected or not cared for effectively because people don't really know what they're doing. But that's what's happening. Not everywhere, but a lot of places. Families are lost. They're overwhelmed. And I felt compelled to make this video to help people, to help families navigate their way through this industry, to ask the right questions of a system that's broken and needs fixing. So let's talk treatment. We all know the recidivism rate is really high in addiction, but why? Is it because the disease of addiction is so powerful? Is it because the patient doesn't do what they're supposed to do? Because we all know rehabs always blame the patient when something doesn't go right. Or is it because many addiction centers are totally ineffective in creating long-lasting change? You see, a good center offers safety, trust, respect, professionals in addiction medicine and psychological medicine who really know what they're doing, a treatment model, medical physicians, psychologists, therapists, holistic healers, and a focus on the family, amongst many, many other things. So, here are the 7 most common mistakes people make when choosing a rehab facility. I could easily list, 20 to 30 things, but in this video, I'm gonna focus on 7. Number 1, choosing marketing over clinical. Don't be seduced by fancy marketing. Marketing gets your attention, but it shouldn't be the deciding factor as to whether you admit to a center. Remember, just because it comes up first on Google doesn't mean it's an effective center. Some centers are spending most of their time, their energy, and their resources on marketing instead of their clinical program. Developing a strong clinical program with an integrated team of professionals to elicit strong outcomes is much harder than a marketing spend. Number 2, ask the center what their philosophy and treatment model is. Yep, ask them. They'll either give you a standard phrase, well, we specialize in trauma, or they'll describe the skills of the clinicians. Well, we can do CBT and DBT and EMDR, or they'll look at you funny because they have no idea what you're talking about, because most centers don't have a philosophy or a treatment model. They either haven't put the time in to figure it out, or they just don't know. They're operating without a unique treatment model. Here's how it goes. The rehab opens up, they hire some clinicians and tell them who they should be seeing and what they should be doing and what their individual thing is, and the rehab contains the clients to keep them safe. But there's no overarching philosophy or treatment model that's outcomes driven and shows you a roadmap of how treatment works and why it works at that facility. Ask a facility to describe what happens from admission all the way to discharge, and how your loved one will improve during the process, and what milestones are being used to show that improvement. Number 3, not asking about staff credibility and credentials. Addictive disorders and mental health disorders are serious. They need to be taken seriously and treated by medical and psychological professionals. Addiction is a brain disease, but it's also a spiritual disease and a psychological and social disease. So a good center must have medical physicians, psychiatrists, psychologists, licensed therapists, and experienced holistic providers. Ask the center who will be seeing your loved one, how often they are seeing your loved one, and what the credentials are of that individual. Counselors and coaches can be very effective for certain aspects of healing, but not as a substitute for psychological and addiction medicine professionals. Number 4, don't pick a rehab that offers minimal individual care. Many rehab centers offer lots of groups, but very little individual care. In fact, many outpatient centers offer more individual treatment than inpatient centers. Although groups can be powerful, individual sessions are where more change occurs. You can't hide in an individual session, and the work is catered toward your specific problems, your triggers, your obstacles, your symptoms, and your overall identity. Ask the center how many individual sessions are provided per week and who they would be with. In an individual session, you can really see how motivated that client is to change. Number 5, don't choose a rehab with minimal psychological expertise. Addictive disorders and psychological disorders are absolutely intertwined. If a center has great addiction care, but poor psychological care, it's just simply not an effective treatment center. Ask about the quality, the experience, the credentials, and the time spent with their psychological experts. A drive-by psychiatrist, a term I use to describe doctors who go to multiple facilities, spending little time with the clients and not following a center's treatment methodology, is very different than a full-time or part-time staff member who you can build rapport with and talk to on a regular basis. Number 6, make sure you know how the family is integrated in the treatment. We all know that an addiction or mental health condition is essentially a family disease. It has a profound effect on all family members, and the family can absolutely improve or worsen the condition and its symptoms by how they handle the disorder. Dismissing it, enabling it, increasing stress, being supportive. The inclusion of family members is a delicate and tricky process. On one hand, you want the patient or client to feel supported by the center and to feel safe, and sometimes the family is not safe. But at some point, the family members must be included to make long-term progress. So ask the center how they incorporate the family, not just if they incorporate the family. Number 7, not asking about the philosophy behind medication prescribing habits. I've always said any doctor can prescribe, but a good doctor knows when not to prescribe. Some centers utilize doctors who prescribe way too much, or the center tends to want doctors to over-medicate. See, they just want to keep the patients compliant, so they medicate them rather than doing the harder work, which is tapering medications over time and revealing the real, raw individual underneath that cloud of medications. Working with that true, raw client is hard work and requires experienced medical and psychological professionals and an experienced support staff to create that change. So in summary, there are good treatment centers out there, good ones, but many more ineffective ones, some even dangerous. These centers aren't set up to create long-lasting change in their clients. As such, people don't get better, and the recidivism rate continues to rise. And unfortunately, this is the business model of some rehab facilities. The clients keep coming back because even though they're not getting better, there's familiarity and safety in that facility. So remember this. To find effective care, it's not as daunting as it may seem. You have to do some research and ask these types of questions. If you want good help, go to a center that has qualified staff whose selling point is a really good treatment philosophy, not the thread count, the sunken pool, or the teriyaki chicken. Pick a center that measures outcomes, that has milestones to let you know you're doing well. Pick a center that respects you and empowers you, not makes you dependent on them. I'm tired of seeing good people pick ineffective treatment centers, leaving them frustrated, hopeless, financially depleted, lost, and suspicious of an industry that's supposed to help and heal, not take advantage of people in distress. I wish you luck and insight in your treatment journey.